Gallstones by Annika Ludwig. So a general overview are gallstones are stones that are produced in the gallbladder, and that is located just below the liver. It's a little pear-shaped organ, and it collects and stores bile produced by the liver to later be deposited into the small intestine after the ingestion of food. And this bile is composed mostly of cholesterol, bile salts, and bilirubin, which is also what creates the stones. And most of the time, this goes undiagnosed unless someone is in severe pain. And gallstones affect 10 to 15% of the American population. For this presentation, we're going to be mainly focusing on ones that cause disruptions. It can lead to infection due to inflammation and blockage of the bile ducts, which then require removal. So there are many different causes for this. Some of the risk factors include age, so being over 40 gives you a greater chance of developing them. They can be genetic. You can have a genetic predisposition to this. Women also are more likely to have gallstones, and what also can happen with this is the hormones from pregnancy, birth control, and hormone replacement therapy after menopause also put you at a higher risk for developing them. Next is going to be the anatomy, so there can already be functional problems within the gallbladder itself, but you can also come from short bowel syndrome, diabetes, hemolysis, and cirrhosis. Weight, if you are overweight or obese, this can also cause this, and diet has an effect on this as well. If you have a high calorie diet, this can cause it. It can also be caused by a diet high in refined carbohydrates and diets that are low in fiber. And also rapid weight loss can cause this, so especially after weight loss surgery, this is a problem for patients. So diagnostic testings are an ultrasound, which is going to be the first choice for a diagnostic procedure, and they can also be found by chance when doing an ultrasound of the abdomen for other reasons. There's another type of ultrasound, which is called an endoscopic ultrasound, that can also be used, but this is an ultrasound that's taken from within the body. X-rays can also be done in a special X-ray known as the endoscopic retrograde calligraphy, where a tube is run from the mouth to where the bile duct opens in the duodenum, and contrast is injected into the duct for X-ray purposes, and then they can remove the stones using the same device during the same procedure. Another one is the magnetic resonance calligraphy. This takes cross-sectional images of the bile duct system. So for your general assessment, the patient is going to feel nauseous, they might be vomiting and have some regurgitation, they may be feeling too full, and they also may be experiencing flatulence. During the abdominal assessment, so it is located in the upper right quadrant, so they will be tender there. So when you are doing your palpations, they may feel some pain. There also may be pain after eating, when the gallbladder is attempting to squeeze bile through the bile ducts, and there might be an issue due to a stone blocking the bile duct. Some multidimensional interventions include nursing care, surgical intervention, and nutrition. So while not all gallstones are asymptomatic, some are symptomatic. And if it's causing severe enough pain, or if there's an infection, it may require the gallbladder to be surgically removed. And a nutritionist can also be involved, as a diet heavy in fats and refined carbohydrates can increase the chance of getting gallstones. And they also need to be educated about having more fiber in their diet. And that is it.